Strep throat 101. Does your child have a sudden intense sore throat, fever, maybe even a tummy ache? This might be strep throat. Let's break down the basics. So, strep throat is an infection caused by group A Streptococcus bacteria. And you got to look for symptoms like I said, rapid onset of throat pain, fever, possible headache, and swollen tonsils, and sometimes with white patches on them. And kids between 5 and 15 years old are the most common targets, but it can appear at any age. Now, left untreated, strep can lead to some serious complications like ear infections, tonsillitis, sinusitis, or even rheumatic fever, but that one's pretty rare. Early identification and treatment help prevent these bigger issues. So, if your child shows these signs, call your pediatrician for a strep test. Quick action means faster relief and fewer school days missed. Testing and treatment for strep throat. If you suspect strep throat, here's how we test and treat. Because let's face it, we all want our kids getting better quickly. So, diagnosis usually involves a rapid strep test, which is a quick throat swab that can give results within minutes. If it's positive, we usually start antibiotics. Now, antibiotics don't just speed recovery. They also reduce contagiousness to others and lower the risk of complications. And in some cases, we'll also confirm with a follow-up throat culture. And meanwhile, at home, we want you to encourage rest, fluids, soothing foods like warm soups and cold treats to help them with their throat pain. Pain relievers like acetaminophen or ibuprofen can be used as directed, and they can really ease discomfort and reduce that fever. So remember, finish the full antibiotic course to knock out every trace of that bacteria. Stopping early might let that strep come back a lot stronger. Keep your kiddo comfy, well hydrated, and check in with your pediatrician. If things don't improve in a couple of days, make sure you give them a call. Preventing strep and the red flags. Are you ready to keep strep away? Let's talk prevention and the warning signs you shouldn't ignore. Now listen, hand washing is your best defense. Make sure kids lather up with soap for at least 20 seconds, especially before meals and definitely after school. Now, avoid sharing cups or utensils and remind them to cover coughs and sneezes. Now, if someone at home has strep, replace toothbrushes after 24 to 48 hours on antibiotics to prevent reinfection. And watch out for these red flags: high fever that won't break, difficulty swallowing, neck stiffness, or a rash. These could signal a more serious issue like scarlet fever or an abscess forming behind the tonsil. So, if your child's symptoms worsen or don't improve after a couple of days on meds, call your pediatrician. With good hygiene and timely care, you'll keep strep from stealing the show. Let me show you how strep actually spreads, and you're definitely missing these. Parents, if you think strep only spreads through coughing and sneezing, think again. Kids have way more creative ways of passing it around without even realizing it. Let's start with snacks. That open bag of chips, it's not just chips in there. Everybody has their germs in there too. Kids reach in, grab a handful of Takis, and whatever was on their hands, saliva bacteria, ends up right back in the bag on their next bite. Let's talk about drinks. One sip from a friend's water bottle may seem harmless, but that's all it takes for strep bacteria to spread. Even if their throat looks fine, they could still be carrying it. Now, also sports huddles, water breaks, shared gear. This is prime time for strep to spread. When kids are breathing hard, yelling, and swapping sweat, bacteria move fast. Also, towels are another problem. Some kids grab whatever's closest, not realizing it's already been used. And what if a mouthguard gets borrowed by someone because they forgot theirs? That's gross. I don't even know if people still do that. But it's a direct bacteria transfer. Let's not forget about band class. Band class might not have shared recorders anymore, but shared microphones, brass instruments, and even drumsticks still carry germs. Every time a student plays an instrument or speaks into a mic, they're leaving behind respiratory droplets. The next kid picks it up, that bacteria now has a new home. Now, let's talk about birthday parties. When kids blow out candles on a cake, it's not just air. They're sending out a fine mist of germs into every slice. And at sleepovers or play dates, kids share all kinds of things. Gaming controllers, stuffed animals, even fidget toys or fidget spinners. If it's something that they touch a lot and put near their face, it's a potential germ carrier. So how do we stop this? Keep food and drinks separate. No sharing. Label personal items like water bottles and headphones. And if something touches a mouth or face, no passing it around. Simple changes can make a big difference in keeping kids healthy. Now that you know how strep really spreads, share this with another parent. The more we know, the better we can protect our kids. Let's talk about your daycare's secret strep spots. All right, parents, let's talk about where strep loves to hide in daycare. You might think everything is cleaner post-COVID, but trust me, there are still some sneaky germ hotspots you don't want to miss. Let's start with sensory tables. You know, where kids go from playing with water to dry rice to touching their face and then back all over again. It's basically a germ sharing station. Even if daycare staff are wiping things down, little hands move fast and strep bacteria love a good, wet environment. And nap time. Sounds peaceful, right? But for germs, it's prime real estate. Even though many daycares have stricter cleaning policies now, kids still drool, cough, and rub their faces into shared nap mats and pillows. If one kid has strep, those surfaces can keep the bacteria around long after nap time is over. Now let's talk about the real travelers. Shared toys. You know that teething ring your baby played with? It's probably made the rounds. Even though most daycares sanitize more often now, some high-touch toys still get passed around before they get cleaned. And those dress-up clothes. They may not be as popular post-COVID, but kids still swap hats, scarves, capes, which means they're swapping germs too. And let's not forget about reading corners. Although they look cozy, they have shared pillows and plush puppets, and those carry germs. They're basically strep magnets. Kids press their faces into them, they breathe onto them, and they pass them along. And while books don't seem like a big deal, those little hands, they touch the mouths and the noses, and they're flipping the pages, and they're spreading the bacteria without anyone noticing. Look, there's no need to panic though. Here's how to help. Label everything. Water bottles, blankets, even extra clothes. Send backups. Have a spare set of clothes. It means less chance of borrowing and sharing germs. And always be mindful of high contact play. During strep season, skipping communal water play and fabric-based toys can help. Now, daycare workers do an incredible job keeping things clean, but even superheroes need backup. Let's talk about strep prevention hacks that actually work. Parents, if strep keeps hitting your house, these prevention hacks will actually stop the spread. No more back-to-back doctor visits. Let's start with coughing and hand hygiene. Look, the biggest germ spreader? Hands. Teach kids the vampire cough. Kind of looks like a dab. Elbow up like they're wearing a little cape. And remember, if they wipe their nose with their hand, they need to wash or sanitize immediately. Kind of like, achoo! Right? I know you got it. Next, germ hotspots. Strep isn't just on hands. It's on everything that kids touch. Keep these clean. Water bottles, lunch boxes, they grab them before and after eating. Tablets, remotes, game controllers. These things require daily wipe downs. Stop the spread. Doorknobs, light switches, school backpacks. Germs love lingering here the longest. Bonus tip. Color code your bottles, utensils, and headphones. Less chance of accidental swaps. Let's talk about a daily defense routine. Before school, clean the hands, clean the gear, label the bottles. After school, hand washing first, fresh clothes second. And for extra protection, shoes and backpacks, stay at the door. Don't track that bacteria inside. Also, quick wipe downs of shared spaces, kitchen counters, dining tables, light switches. Now, what about sick day strategy? One kid sick? Lock it down early. No shared hand towels, assign separate ones, or use disposables. Toothbrushes? Keep the sick kids away from the rest. Controllers and remotes? No sharing, guys. Wipe them down daily. And you can set up a sick zone with their own tissues, water, and entertainment so they're not spreading germs around the house. Look, simple habits, they make a huge difference. Which of these do you already do? Drop a comment and keep your family healthy. Dr. Merchant out.